Well, technology is used in so many kinds of medicine, and now a recovery treatment center has found another way. Joining us to talk about that is Michelle Votel, Clinical Program Manager at Hartford Healthcare's Rushford. Michelle, welcome.
Thank you. Thanks for having me.
Sure. So tell us about the smartphone app. Is it called TryCycle for patients in recovery at Rushford? Tell us how it works.
Sure, it's a technology system that creates digital communication between clients and their clinical team. There's two parts to the app. There's an inventory piece of it and a free-form journaling. And in the inventory piece, there's 8 recovery questions. There'll be things like, how are you feeling related to your stress at this moment? Are you feeling hungry, angry, lonely, or tired? Are you taking your medication as prescribed? And clients will give a response to that by selecting an emoji and a short, brief text that may describe how they're feeling at that moment, something like not at all, or all the time, or somewhere in between.
All right, so I understand you use the app to connect with hundreds of patients during COVID and provided interventions. How so?
Yeah, absolutely. So we really pivoted when COVID hit. We made a concerted effort and really worked all together as a team to get all clients onto this tool. We had 759 interventions in 100 days when COVID hit. And that's over 750 times where through the use of this app, we learned that clients were at risk outside of treatment times, and we were able to connect them with a recovery coach.
That's wonderful. What about the role of the recovery support specialist in reaching high-risk patients?
Yeah, so the recovery support specialist is someone who is in recovery themselves. They are a peer, and they are trained on substance use disorder and mental health. And they support the clients through the use of this app. They receive red risk alerts and are able to reach out proactively at that time. So they reach the right client, the one that's at risk at that moment, rather than waiting for the next day when they're in treatment again. And they really help them transition into the community, living a sober life. There are people who have been doing this for some time and can mentor.
And you talked about how you utilized this during the pandemic, but how has it changed how you treat patients now? Is it part of standard work now?
This has become our standard work process. So every client that comes in now is provided with information on this tool. They are onboarded to the app and also provided with a recovery coach at time of intake, regardless of level of care.
All right. And Michelle, for those who don't know, I always ask, just tell us a little bit about Rushford.
Oh, so Rushford has lots of components to it. It's part of the Behavioral Health Network, which is part of Hartford Healthcare. And Rushford has lots of sites. They have inpatient in Middletown, and they have various satellite sites across the state, open to all people with insurance, state insurance, commercial insurance, all ages. We do have some adolescent programs, and we also have adult programs as well.
Excellent. All right. Thank you, Michelle Votel. Thank you so much for joining us. We appreciate your time.